Next, I invite Dr. Girija K for the presentation, My Outlook on Impact of AGIS in Management of Advanced Glaucoma. Madam is the head of the Glaucoma Services, Little Flower Hospital, Angamali.
Good morning, everyone. So, my outlook on impact of AGIS on management of advanced glaucoma. As all of you know, the advanced glaucoma intervention study was done, as the name implies, on advanced glaucoma patients with on maximum medical treatment and uncontrolled IOP, and the response to two treatment sequences were compared. Actually, the one group was given laser trabeculoplasty as the initial treatment, and the other was given trabeculectomy as the first treatment. And in case of failure, the sequence was, in the first group, trabeculectomy followed by organ laser trabeculoplasty and then trabeculectomy, and in the other, organ laser trabeculoplasty followed by trabeculectomy and then trabeculectomy in case of failure. The data was analyzed and 14 reports were prepared. The patients were, they had to undergo one baseline visual field, and the visual field was scored, and those with scoring of 1 to 16 were included in the study. Actually, the real advanced cases which had 16 to 20 scoring were excluded from the study, and that is one of the limitations of the study. And the baseline characteristics of those involved were studied and they were examined, and the differences were noticed. That is, the Afro-Americans were mainly of the younger age group with more of hypertension, more severe visual fields, hyperopia, and the IOP was similar in both the groups. The Caucasians had an increased incidence of disc hemorrhage. And the reduction or the response to treatment, the racial difference was studied, and it was seen that better response was shown by blacks to the ATT sequence. And the bleb encapsulation following trabeculectomy, it was seen more when the trabeculectomy followed laser trabeculoplasty, and it was seen more in males. And following cataract surgery, the improvement in visual fields and visual acuity was better. And this is the AGIS 7 report is the one which has helped us in managing the cases actually. That gives us an idea about the target IOP and the response in visual field deterioration. That is, those patients who had less IOP, that too early response, they showed less deterioration. And those who had 100% of the visits when the IOP was controlled, or the target IOP 18 was reached in 100% visits, mean they had minimal visual field progression. So, that is one clue. That is actually this study has reinforced the concept of target IOP. And the risk of cataract was studied that after trabeculectomy, it was seen to be more when postoperative complications like shallow AC or any other complications were there. And the glaucoma outcome, the racial difference was studied, and it was again, I have previously mentioned, the blacks had a low risk of failure of the first intervention in ATT sequence. And the risk factors for failure of TRAB were identified as younger age, the higher IOP, then postoperative complications, and marked inflammation. So, the IOP was lowered in both sequences, but blacks showed a better response with the ATT sequence. And how to confirm visual field progression from visual field fluctuation. So, this also gives us a clue. The visual field test, when repeated after 6 months of worsening, had 72% probability of detecting a persistent defect, but it was done, if it was done twice, so the probability increases to 84%. So, the repeatability always should be there. What are the limitations of the study? Actually, the predictive and associative analysis that was done in the AGIS 7 was not part of the original protocol, and bias may therefore be introduced into the analysis. And as a baseline, only one visual field was taken, as we all know that at least 3 should be taken. And the cases were not stratified according to the degree of glaucoma damage. And the real advanced cases were not included in the study, and the other ethnic groups were not included in the study. And another one is in trabeculectomy, only 0.5% cases they used antifibrotic agents. Especially, we know that blacks show a better response when the antifibrotic agents are used. and the rate of complication was also not discussed. So what are the implications of this study on clinical practice? So AGIS showed that early response to treatment predicts a more favorable outcome. Those who achieved the target IOP had a better preservation of the visual field, and those who have not achieved target, even after 6 months, they did worse. So early achievement and target IOP, that was the importance was stressed on this. And the extended use of antifibrotic agents have been associated with better results in plaque patients. So that is the standard of care now. And nowadays, even though trabeculectomy is still the gold standard and is the conventional primary surgery, the technique has evolved to include the use of MMC, releasable sutures, laser suture lysis, etc. to improve the outcomes. Then SLT has now surpassed the ALT as the preferred treatment because of the better safety profile, and it is used much earlier in the disease course, even before medication. And 30 years of development since the publication of AGIS has brought to us a range of new medications and also a variety of surgical solutions like MICs and GDDs, which were not there in the time of AGIS. So if AGIS were to be repeated today, the likely modifications would be to decrease the target IOP to the mid or low teens, because 18 millimeters is no longer considered the magic number, and to standardize the filtration surgeries with the use of antifibrotic agents such as MMC with initial trabeculectomy itself, and to replace ALT with SLT, and that could be offered earlier in the treatment sequence. But the number of medications available would increase the complexity of step management. And in addition to the standard trabeculectomy, subconjunctival microstents and all the mixed devices, that mix can be used, but even though it produces only a moderate decrease, can be combined with medications, and GDD could be used, and OCT could be added to monitor the structural parameters of optic disc and RNFL, and measurement of CCT, corneal hysteresis, etc. could help the risk of stratification and target IOP setting, and other ethnic groups could also be included. So the recent study that is being conducted in the UK, that is the TAG study, that is the treatment of advanced glaucoma study, probably that will help us to modify the treatment. Sometimes that can give us better guidelines.